Hello, my name is Dr. Burak Kocak. I'm a professor of urology at Koç University School of Medicine in Istanbul, Turkey. I'm also the director of the kidney and the pancreas transplant program at Koç University Hospital Organ Transplant Center. I am mostly interested in kidney transplantation. I do kidney transplantation in adults, kidney transplantation in infants and children, and I also do robotic kidney transplantation. At Koç University Hospital Organ Transplant Center, we have been doing kidney transplants over 5 years, and we have a very cumulative experience in kidney transplantation. Myself and my team has an experience of 3,000 kidney transplants in adults and more than 500 transplants in infants and small children. We can transplant kids as small as 6 months old and even 5 kilograms in weight, and we are a very experienced team transplanting kids in their first year of life, infants and very small children. We can also transplant children with urological abnormalities. We can transplant kids with artificial bladders and in kids that have bladders from their small bowel as well. And Koç University Hospital has a mission of innovation, teaching and international collaboration. So the university and the hospital wants to focus on collaborations with all the institutions abroad and neighboring countries. We have received €2.5 million from European Union to build a new state-of-the-art immunology lab in our hospital. The aim of the European project is to increase the quality of testing, immunological testing before transplant, and to increase the half-life of the kidneys that are transplanted in Eastern Europe, in Turkey, and in Middle East. So the aim of the project is to increase the success of kidney transplants that are transplanted in the region as good as that are done in North America, Europe and Japan. Koç University Hospital is focusing on this very important mission to increase the success rates of all kidney transplants, not only done in Koç University Hospital, but in Turkey, in Eastern Europe, and in Middle East, to bring the success rates as high as those ones that are done in North America, Europe, and Japan. So for some time, we have been focusing on innovations that are going on in transplant medicine. Now, the world is changing, medicine is changing, and the surgery is changing. We have been experiencing robotic surgery in the last 10 years, over a decade, and in the last 5 years, robotic surgery has started to go into usage in transplant surgery. So we have started to perform transplant operations with a robot. In the last 3 years, we have focused to do robot-assisted kidney transplantation, and now Koç University Hospital is one of the 15 kidney transplant centers in Europe certified by the European Society of Robotic Urology, Robotic Kidney Transplant Group, and we are among the few centers in the world performing this state-of-the-art operation. On top of that, I think both in Turkey, Eastern Europe and the Middle East is in the need of a transplant, especially in kids. Although a rare group of patients in need of transplant, it's really a precise and difficult operation to perform a kidney transplantation on infants and small kids. And we have an experience in children more than 500, with 500 patients. We are mainly trying to focus especially in infants that are children less than 1 year of age, and in small children that are 5 years of age, and of course also on other children who are on, who have chronic renal failure and on dialysis, and we are trying to transplant those kids in order to get them out of dialysis. We can transplant kids as low as 6 months old and even 5 kilograms in weight. And so our mission is, to increase the rate of kidney transplantation in infants and in small children, both in Eastern Europe, in Turkey, in Middle East, and in Asia. So all these children can get a kidney transplant instead of staying on dialysis. I think the kids and the adults with urologic problems constitute a major group of patients that are in need of kidney transplant. They have always been a difficult group of patients to transplant on, but now we can, transplant a spectrum of patients that have, urologic abnormalities, that need a new bladder, even from a intestine. So we can, transplant children and adults who have urologic abnormalities, even who do not have a urinary bladder. We can, make a bladder from their bowels. We can form an artificial bladder and transplant these patients. And the success rates are as good as the other regular patients. So now it's not a contraindication for those patients with urologic abnormalities to get a transplant. I think the world is changing, and with technological improvement, the medicine is changing and the surgery is changing. We have experienced robotics incorporating into surgery more and more in the last decade. The robot gives the surgeons great comfort, and while they are performing their surgeries, and to help the surgeons to improve the success rate of their treatment. And in the last 5 years, it's becoming, the robotic kidney transplantation is becoming more popular. So we have been, implanted robotic kidney transplantation into our program in the last 3 years, starting from 2020. Now we are doing more and more robotic kidney transplantations in our daily practice. Who knows, maybe in the near future, robotic kidney transplantation will be the gold standard to perform a kidney transplant in a recipient. And that's why we would like to, share our experience with our colleagues, not even in Turkey, but neighboring countries like the Balkan Peninsula, the Middle East, and Asia, so they can know our experience and could get an idea that a robotic kidney transplant is a viable option for kidney transplantation, and it gives the patients the whole benefits of a minimally invasive surgery, even in kidney transplant operation. And this symposium is focusing on robot-assisted kidney transplantation, just to give our colleagues how the robotic surgery is incorporated into kidney transplantation, the technique and the results of this operation in kidney transplant patients. So we can share our experience and they can get an idea about the developing robotics in transplant surgery. I hope it would be helpful to all our colleagues in Bosnia, so they can get an idea how robotics is going to incorporate into kidney transplantation in the near future. It's great to be in Bosnia, and I would like to thank you for your attendance.